Before we get started in the webinar, we want to take care of a few details. One is that we're excited to be providing interpretation in Cantonese and Spanish. So if you need to use interpretation, please follow the instructions that are on the slides that we'll be showing. We also emailed out the instructions if you prefer to access that way. We're also really thrilled to be using closed captioning today. So if you need to use closed captioning or would like to use closed captioning, please click on the closed captioning button on your screen, and closed captioning should appear at the bottom of your screen. We've interpreted the slide decks into Chinese and into Spanish. Those were mailed out to people who requested them. We're also going to be putting links in the chat. So if you would like to access slide decks in Spanish or Chinese, please feel free to do so through the chat or through your email. And if you're having technical difficulties accessing captioning or language or other technical difficulties, please feel free to chat. That's how we're going to be communicating today. So again, thank you for coming to this webinar. We're titling this Education and Mental Health Challenges During COVID-19 for Families of Children with Special Health Care Needs. This is part one, titled Choosing Peace Over Choosing to Be the Perfect Parent. And again, we're going to be focusing on mental health challenges today. So before we start, we'd like to do a poll. So Pip, will you launch the poll? So if you would please go ahead and let us know a little bit about you, we'd appreciate it. So while we're waiting for the poll response, I want to tell you a little bit about Family Voices of California. Family Voices of California is a statewide collaborative of parent-run centers that are working to ensure that quality health care for children and youth with special health care needs. Family Voices of California builds the capacity of parent centers throughout California to provide families with the information and support they need to make informed decisions about the health care of their children. Family Voices of California provides information and a forum for parent centers and families to advocate for improved public and private policies, to build partnerships between professionals and families, and to serve as a vital resource on health care. Today's webinar is the first of two-part webinar related to the challenges families of school-age children are facing during this difficult COVID-19. Today, we're going to be focusing on mental health and stress-related challenges, and part two is going to be focusing on specific logistical questions families encounter as they navigate how best to support the educational development of their children. And we'll focus on district offerings, service provision, and legal options. This webinar is offered this coming Friday, September 25th. And you can find the link to the webinar on the Family Voices website. Want to let you know that this website is going to be This website is going to be recorded.
Just so you know, I have two devices going.
Sorry about that. So we're recording this webinar, and it'll be available on the websites. And we're going to be answering questions at the end of the webinar. So please hold your questions. And the way we're going to be answering questions is we're going to collect them on the chat feature and then ask the presenters or panelists those questions. So as we go along, if questions come up, please feel free to put them in the chat and we'll sort through them and ask them at the end. So before we start, I'd like to give a special thanks to our captioners and our interpreters. So thank you, Kai Louie, Oscar Arteta, and Deanna Baker. And good, our results of our polls have popped up. let's see, it looks like we have a lot of people who identify as professionals who are working with families, and that we have about 25% of us are identifying as parents, and about 8% of us who are identifying as none of the above. So we have an interesting combination. I'm hoping that you will all enjoy what we have to say. I'm Alison Stewart, and I'm facilitating today's workshop, our webinar. I work at Support for Families. I'd like to welcome our panelist, Lilian Ansari, who's a parent of 2 kids with special needs. And for the past 10 years, she's been working passionately and diligently as a special needs advocate, helping other families of kids with special healthcare needs navigate systems and get the services that they need. We have Barbara Kalmanson, who's a clinical psychologist, and she brings 50 years experience as a clinical psychologist, a special educator, and an infant mental health specialist, and Lindy Joffe, who's an occupational therapist, who is currently working on her post-professional doctorate at Boston University. Lindsay is really interested in the ways in which motor, sensory, and reflex affected systems interact with cognitive processing skills to propel individuals' regulatory and problem-solving abilities. We're very fortunate that Lindy has been an intern with us this summer at Family Voices. She's been instrumental in helping us collect the data that we're using in part of today's workshop. So with that, I'm going to go ahead and hand things over to Lindy.
At the end of July, Family Voices sent out a survey asking families about their experience with distance learning. It was essential to hear directly from families in order to be able to respond accordingly. Thank you to everybody who responded. Here are some key findings from the survey. We had 360 responses, 329 of which were in English and 31 of which were Spanish speaking. 73% of the people who characterized their distance learning experience in the spring characterized it as a negative experience. 75% reported high levels of distress, and 86% reported significant disruptions to their routines. 51% of parents felt ill-equipped to manage the demands of online schooling. So you can see that that people were reporting significant distress during this time. Next slide. What this slide shows is that we asked parents to report their general concerns, and what we found was that engagement, logistical concerns, mental health, service provision, and socialization were all concerns by the majority of people who responded. And in particular, engagement and distance and socialization were reported as concerned by almost 90% of the people who responded. So in the end, I'm still exhausted and frustrated, and my son is struggling. This was a quote that one survey parent wrote down on the survey. And I felt like it really summed up the feelings that were presented by so many of the parents. In the end, I'm still exhausted and frustrated, and my son is struggling. Thank you again for your responses. We heard you loud and clear, and we took your voices and suggestions to the California Department of Education. We're currently researching the appropriate legislative committees to do the same. It is our wish that the strength of your stories will change the educational circumstances for our families so that the numbers in these slides will be a distant memory. We hope that you find these webinars helpful as you negotiate these challenging times. We wish you health and peace.
Thank you, Lindy. Next up, we're going to have Lilian talk a little bit about her family perspective. Thank you, Lilian.
Thank you for having me. Hi, everyone. So yes, I was one of the parents who filled out that survey. I am parent to 2 children with special health care needs. I have a 15-year-old that has autism, anxiety, sleep disorder, learning disabilities, and a number of other challenges. I have an 11-year-old that has a genetic disorder,
Hello.
tuberous sclerosis complex. She has epilepsy, autism, and developmental delays. And I've been saying that I realize a lot of families are struggling right now with everything that's going on, but I really feel that families like ours are not just struggling, but suffering. Having a child with a disability can be very isolating, and a lot of us have worked really hard to build a community of support folks and other families, and now that community is pretty much gone, and the virtual connections are just not the same, as most of you know. Normally, every week, my daughter, who is more impacted by her disability, has 15 different teachers and therapists supporting her. My son, who's less impacted, has 8 people supporting him to get through his days. And now it's just me. And I've had to, I had worked very hard on building a
He
practice.
trabajado mucho en esto.
Sorry. And now that's also gone, and I've been forced to be a stay-at-home mom again, not by choice. Our family's fortunate that we can still survive on one income, but I know a lot of other families in a similar situation that we are with their children that
How about
are
now?
to work on survive on one income, and that's also been a real hardship for a lot of our families. My daughter, my 11-year-old, is also at risk of serious complications if she does contract COVID-19. We had a child with a similar condition early on that actually passed away. She had a status seizure and had a stroke and passed away. So it's very scary. And we've had to be extremely isolated. She was just learning to read at 11 years old and entering middle school. And now, because she really can't access online learning without 100% support, 100% of the time in support, she's regressing academically, and she's also regressing socially and emotionally. A lot of things that sort of come easily to a lot of kids her age and my son's age require full support by someone. And, things like personal hygiene, feeding, sleeping, dressing, socialization, learning, all of that requires full support. And I'm really just physically, emotionally not able to tend to both of them. I remember that before the pandemic, my husband and I had this conversation about how our life is so hard and how can we live like this? How can we continue to live with this level of stress and chaos? Because both our children also have behavior issues, and little did we know it was about to get much, much worse with a lot less support. And we were already feeling like we were running on fumes, and the only break we got was when the kids went to school, or when we had an ABA therapist or other support staff at home to support us, where we could actually just get a break. And now that that's gone and parenting is 24/7, our kids also don't sleep through the night. It's just, honestly, I don't really know how we're continuing to go on. And to add to that stress, the guilt of watching a lot of families with typical children kind of thrive, and they're talking about how lovely it is to have all this downtime, and how lovely it is to be able to see their kids every day and spend all this lovely family time together. And for us, it's everything but lovely and connecting. It's quite the opposite. And so watching other families even made a lot of us feel worse, or speaking of my own experience, made me a lot worse, where my children can't even be in the same room together during school because they both have behavior difficulties. They are at very different function levels, so they don't work on the same thing. They don't communicate the same way. They don't play together, so they can't even be in the same room. So in some way, though, to talk about sort of the more positive side of it, if reaching to find a silver lining, is that, or I think that in some ways, a lot of the families with special needs children are more equipped to handle a situation like this. We are used to navigating a world for our children that's not built for our kids. We're used to changing expectations. We're used to crisis and being in survival mode. Still, it is just physically, emotionally exhausting to take care of our kids. I have to say some things that have worked for us is that early on, we added another special needs family into our germ pod. And they also have a child that's medically fragile and immune compromised. And we completely trust them to be very careful. And we have been able to sort of support each other by just getting the kids together, sort of taking turns, taking care of the kids sometimes. That's been a tremendous support. We've also recently looped in one solid support person that we know. I had to really sit her down and let her know how crucial it is that she be very careful to not get exposed. And if she does, that she has to let us know, because we have to wait 2 weeks before she can come back to our home, because it's literally a matter of life and death for my daughter who's immune compromised. We've also, once again, lowered expectations and changed our expectations. I'm not trying to do anything fancy. We're just trying to survive and stay as healthy as we possibly can. We have virtual brunches every couple of weeks with other special needs families, just to kind of keep the connection for us. And we've also had to minimize exposure to social media for us. My kids are not on social media, but for us, because like I said, it's just too difficult to see all the ways in which I feel like I'm failing my kids, where other families are able to do so much, and we just can't. So it's been difficult, and my children will probably, even though a lot of the special needs kids get to go back first, I don't think that mine will be able to go back until there is a vaccine, because my daughter is not a kid that can keep a mask on all day or understand what's going on. So that's where we are. Thank you for listening, and I'm here after our webinar if anyone has any questions. Thank you.
Thank you, Lilian. So Pip, do you want to take a moment and stop sharing your screen for a second?
Yes, I will. Thank you. Let me just, so that we can find Oscar and
Hi, Pip. Hi, everyone. I'm Oscar. I'm here.
Yeah.
I just don't know why
I think it should be
I'm not
working
assigned
now.
as an interpreter. It should be, but
I think so.
I should see a screen that says you have been assigned as an interpreter.
Yes, and I've been trying to do that, Oscar.
Okay.
When I assigned Kai.
Okay, so I'm going to go ahead and maybe you can talk in the chat about getting Oscar reassigned to interpretation. To everyone who's participating, apologize for the interruption. We're just
每個啦，係即係
struggling.
咁參與嘅，我哋啦係好抱歉啦，係即係而家中間打擾咗，因為嗰個西班牙文傳譯嗰個啦係有一啲問題嘅。
Okay, are we ready to Spanish. Okay. So thank you, Lilian, for telling us that story. We really, really appreciate it. So Lindy, we're going to have you talk a little bit about how regulation comes first and some of the information that you would like to share with us. So Lindy, take it away.
I really appreciate, and I'm sure we all really appreciate, the honesty and the forthrightness that Lilian brought to this story. Pip, can you go to the next slide, please? It leads right into how traumatic this pandemic is for so many people, and even more so for our families. The pandemic brings with it so many layers of disruption for all of us. Some of them are concrete, some of them are more abstract, and I think you all know these things already, but I'm going to outline them anyway. The loss of routine, the possible loss of work for so many people, and financial challenges, the isolation. These are some of the more concrete challenges that are hard enough, but the more abstract ones, the fear and anxiety, not knowing when it will all end, the loss of control and confusion, the loss of sense of safety, wariness about others. These are all things that are traumatic enough for all of us adults, but for our kids who don't have the same processing and regulatory skills, the disruption can and often does pull the rug right out from under them. And to top it all off, so many of us adults have been here before, of course, not in a pandemic, but in a place where we felt this loss of control, the loss of safety, the fear, the not knowing where things are going. So in the end, the pandemic can actually layer a sense of trauma on top of past traumatic experiences. And Lilian was talking about this beautifully too. As a group, we and you are nothing if not a resilient people. So in the end, it just takes finding that solid ground. Where is that solid ground? So that is what I want to talk about today. Where is that solid ground? To me, the solid ground is regulation. As an OT, regulation comes first. So if we can find that, we will find where we need to be, and we will find the calm in it. So when thinking about regulation, I think the first place to start is understanding the interaction of the emotional and the sensory systems. The two systems are intertwined in our bodies. Pip, if you can go back to the last slide, please. When one goes up, so goes the other. Thank you. We are this way because everything in our body comes back to safety and protection. So from the time we were predators and prey, if we sense danger or opportunity, we needed to be able to hear better, to see better, and to smell better. With the surge of adrenaline that comes with a lack of safety, our sensory systems increase so that we can be more sensitive to our environments, and our physiology will actually change. We all know the feeling of the hair standing up on our arms, which allows for an increased tactile response and increased tactile sensation. There's so many examples of this in our body. So with a lot of anxiety comes increased sensory reactivity to allow for our fight, flight, or flee response. It's our system that tells us that if our system tells us that this response is not going to be sufficient, that it's not going to work, we do what the reptiles do and we shut down. These are all protective responses that are built into our systems. They're organized by our emotional and our sensory brains. So it's not a surprise that so many of our kids and so many of us have used these coping mechanisms over the past months. Attachment plays a part too. Our love for our kids makes the complexity of our responses to the pandemic that much more layered. Kids with sensory challenges are more dependent upon us for regulation than a same-age child with a better regulated sensory system. And we both feel the weight of the responsibility for their regulation, while of course also welcoming it. All the while, we're struggling to maintain our own. This is one reason I believe that such a high percentage of parents are reporting such levels of distress during this time. Our kids' traumas are our own traumas, and we want nothing more to keep our kids safe and to make things better for them. And of course, kids are sponges for our stress. So the beauty and the challenges that come with the intensity of the attachment to our kids, it works in both directions. Finally, the pandemic requires us to be flexible in how we view our core identities. Prior to March, prior to the shelter in place, our identity might have been that of parent, of advocate, of friend, or maybe of that of employee. But now somehow we have to incorporate teacher or therapist or aide. Our child might have viewed herself as student or friend, but all of a sudden school is gone. And friend in the way that she knew it is gone. And that brings confusion as to what exactly our child is to that child. How can you be a student if you're not at school? We don't tend to think much about the importance of these identities to the grounding of our sense of selves, but as an OT, I view them as fundamental. One of the biggest challenges of life during the pandemic has been maintaining the flexibility required to us to maintain these identities. During this time, no matter how hard, we have to be gentle and forgiving with ourselves and with others. Next slide, please. So when we think of the developmental milestones, we tend to think of the motor milestones and the speech milestones. But in fact, the first, and I think the most important milestone, is the ability to be calm and alert. In typical development, being calm and alert comes by about 6 to 8 weeks of age, and it comes in with the social smile. Periods of calm and alert increase in length throughout infancy and early childhood. By kindergarten age, a child is expected to be relatively independent in the skill, with inner moments of help from trusted adults. With the ability to be calm and alert comes the ability to engage, to learn, to pay attention, to listen, and to play. Without it, we might be able to move about, but we don't do it safely.
Hello.
Oops, sorry. We might be able to talk, but we can't necessarily communicate. If we can't find our calm, then we can't expect to achieve any of our other goals. This is as true for an infant as it is for a child, as it is for any one of us. So the first step becomes finding that calm. So how do we do it? Because we all know that it's not easy. And the first step there becomes big picture thinking. So as I said before, the sensory and the emotional systems work in concert with one another. Anxiety leads to narrowed vision. If you think of a deer out in the grasslands grazing away, that deer is taking in all the sensory information from throughout the plains, but all of a sudden she senses danger. And you can think about the way her posture and her focus shifts. And now, instead of taking in that big picture, she makes a beeline. All of her sensory and motor systems focus on a central point in order to keep her safe. Our bodies do the same thing. There are muscles in our eyes that change our lenses so that we can see more centrally in our central vision, and our periphery, all of it gets blurred. Same thing with our ears. We hear more centrally, and we can't hear what's going on out there. Everything gets narrowed. But for the deer, the danger is the predator. It's distinct, it's concrete, and it's short-lived. For us, it's very different. The danger is very abstract. It's global and it's ongoing. So when our bodies go to this narrowed place, we lose that big picture and we're more likely to get stuck. And we lose that very resourcefulness that served us so well up until now. So we need to fight the instinct to narrow in order to find the calm in the chaos. Now, I can't give anybody suggestions as to what will work for your family, but after 20 plus years of working with families, I know one thing, which is that you are already the expert in your family. So if you can think about what regulates your child, what regulates you, who are the people and therapists in your life that support this place for your family, and how can you generate more time with them? Just like Lilian was saying, who are the people that she can trust in her family? Who are the providers that she can trust? Who are the people that are going to help ground your family to help you find that calm place? Next slide, please. These are strategies that were put forward by families on the survey. I broke them up into family-centered strategies, child-centered strategies, and parent-centered strategies. And they're not here for anything but to give ideas. It's certainly not an exhausted list. It's just to give some ideas and to spark your own creativity. There are lots of different ways that people have found just to make things just a little bit easier. Next slide, please. These are two example quotes that I pulled from the surveys that exemplify this idea of big picture thinking and that have enabled parents to find the calm. I have learned to rely on my inner voice and my heart to tell me that enough is enough. I'm not going to drive myself crazy and work hard for someone else to get paid. I have to take it day by day and do as much as I possibly can and make sure my family is happy and healthy. And the best things I have done that are actually sustainable are the activities that all three kids and I can participate in. We've made up our own board games. We do treasure hunts. We play games, and we take turns with the AAC device. So these are two very different ways that families have found to essentially find their own grounding, their own calm. It sometimes helps me to think in analogies. Sometimes the pandemic to me is like a hurricane. And if we can keep ourselves in the eye of the storm where it's calm, flexibly moving along with it, then I think we'll all be okay. Next slide, please. So with all of this, what do we actually do with education? Because that's where we started. I put together a flow chart, and hopefully it can help as a guide. The first step is asking the question, is your child regulated? If the answer is yes, then the question is, does school support your goals right now? And if the answer is yes to that, then we can focus on adapting the home environment so that whatever schooling model you're engaged in works well for your child. If the answer is no, then the idea is to use the IEP process to ensure that your child has the accommodations he or she needs so that school can work well. The education-focused seminar on Friday will more specifically address advocacy in this area. But if the answer is no, then it may require taking a break from school or minimizing participation until he is re-regulated. And that's okay. Remember that no child is going to be able to learn academically until he is regulated. So pushing school in that situation only winds up backfiring. But lots of learning happens through life experiences. The key is learning, not specifically academics. And if you need to shift priorities for the time being, you may need to refocus some of your goals. And again, that's okay. Those goals can shift back solely to life skills, or they can address academics, but through meaningful activities. The more meaningful activity, the more buy-in you will have from your child. I have a kid on my caseload who was struggling with the abstractions of math, but he loves money and he loves business. We made everything into money first, then we translated it back into math, and he understood the abstractions. For those for whom academics are just too much, it's a great time to work on flexibility, engagement, and organization under stress. When regulation is reestablished, we can always look back at reintegrating back into school. And I know this flow sheet is relatively simple, but hopefully it's helpful. And with that, I'd like to turn it back over to Alison.
Thank you, Lindy. That was excellent information. We're going to move on to Dr. Kalmanson to talk a little bit more about kind of the stress and mental health. Take it away.
Hello. I think that much of what I'm going to say to you will reflect back on the things that you've already heard, both from Lilian and from Lindy. And I titled my talk Crisis and Opportunity, thinking about the Chinese symbol that represents both. And how can we use this crisis as an opportunity in our lives for growth and development for ourselves as parents and for our children. So here we can see that even though there's a pandemic and now also wildfires affecting our everyday life, even our breathing, we can also see an opportunity for strengthening family relationships and using this as a time of learning. But perhaps the time of learning that we're creating is a time for learning to manage stress, learning to build resilience, and learning to establish self-regulation and co-regulation, the regulation that happens between parents and their children, even when there's stress in front of us. Could I have the next slide, please? We know from lots of research that stress influences learning. And so it's going to influence any child's readiness to learn. What we want to be able to do is we want to be able to help the children feel regulated and safe so that we can promote their readiness to learn. If we're coming in with academic expectations and that we don't see that child with us from a point of view of felt safety and security, then we know we have to first look at the safety and security of the child before we're ever going to get to any of those academic tasks. We also know we need to titrate stress so that it's moderate, controllable, and predictable. And we can do that through closeness and comfort in relationships. We know that prolonged stress, which we've all been experiencing now, is equal to exhaustion, decreased focus, and increased irritability. Can I have the next slide, please? Here we are with a decreased sense of control, and these threats from our environment lead to feelings associated with trauma. When we feel vulnerable, exposed, scared, and isolated, we have the formula for our bodies and our minds to send messages to us that we feel traumatized. And we're not able to cope in the same ways that we usually can. So we need to figure out what we can do in this time to bring down the level of stress and allow us to feel less vulnerable, less exposed, less frightened, less isolated. Could I have the next slide, please? Fear is a basic feeling associated with traumatic states, and it's the psychological or mental interpretation of our physiological state, what we feel inside. And the stress that we experience creates defensive actions. Those actions are self-protective, but they can also be self-deceptive. And they cause us to act in dysregulated ways. We get irritable, we get angry, we get sad, we get impatient. These are all things that are the result of stress and of our bodies trying to protect ourselves. But one thing we know from psychological and physiological research is that our social behavior regulates the child's physiological state. So that when the adult caring for the child communicates a sense of safety, a sense of security, and a sense of calm, that influences the child's physiology so that they also feel that sense of safety themselves. When we see a dysregulated child, we know that that child is calling out to us, please put me in a calm place. And here I want to emphasize that we can answer that call not by timeout, because isolation increases the physiological sense of stress. We're going to answer that call through co-regulation. That is the caregiver providing the child with comfort and safety, so that there's intimacy and closeness that communicates to the child, I know what it feels like to be you right now, and I can help you find the calm place. Can I have the next slide, please? Here we have a graphic from a colleague of mine, Bruce Perry, who works in the area of trauma and has an organization called the Neurosequential Network. And he has many videos and informational PowerPoints that you can find if you Google him. But he paints a picture of how we manage stress. And it can be chaotic, severe, prolonged, and uncontrollable. But what we need to do inside that feeling state of stress is to create something that feels more predictable, more moderate, and more controllable. And he lists here many ways in which families can try to do that. And I'm going to go through them in my next slide. Could I have the next slide, please? So the main thing that we can do to manage stress is to build resilience. As parents, we want to build our own resilience, and we want to help build resilience in our children. And here we know that children who feel resilient have someone who's in their life who's steady on in helping them to feel safe and secure. And we can do this by providing a daily structure that includes family meals, time together off the screens, exercise, managing children's sleep patterns. And we ourselves as adults can manage by reaching out frequently, even if briefly, to members of your community and to members of your family, checking in, even for 2 minutes on a daily or every other day basis, to have contact with the people with whom you feel social and emotional support. And we can also build resilience by helping others. And this helps us feel better about ourselves. Let's look at the next slide. Our current goals in mental health and in education at this point in the pandemic are really focused on relationship, safety, and regulation. If the child is in any kind of learning environment at all, we need to make that learning meaningful to the child. And Lindy gave a wonderful example of that in turning all the math problems into money problems. But we can also make it meaningful to the child by joining and expanding on the child's ideas. Sit and watch. What is your child doing right now? How can you join that to make it social, to make it fun? Because we want to focus now on playful interactions that promote a sense of shared pleasure. Where is the pleasure in being together? And when you find that, when you know what that is, then take permission to focus your time in that kind of activity of being together. Because this is what's going to build the emotional muscle to make it through this pandemic. For educators coming on screen into people's homes, we need to be extremely sensitive to the cultural characteristics that influence our child rearing practices. And we all need to acknowledge the stressful conditions around us. When a child is distressed and upset, nothing makes them feel better than knowing that the feeling they're having is understood, that we know what it feels like to be them right now. May I have the next slide, please? And so in the end, we're looking for moments of joy and laughter to relieve the stress. Whatever's fun in your family system, take permission to do it, spend time on it, and don't worry about the things that you think you're supposed to do. Because the thing we're most supposed to do in times of stress is to manage the stress emotionally and physiologically. Can I see the next slide, please? If you'd like more information about some of these ideas, you can look at the website, kidsattuned.org. It has many papers and articles and instructional videos, educational videos that are useful to professionals and to parents alike. And I encourage you to browse around and see if there's anything useful to you there. Thank you so much.
Okay, Pip, can you change the slides? So I want to thank our three panelists who all brought interesting and important perspectives to the situation that we're experiencing today. And we have some time for question and answers. So if you have any questions of any of the panelists, please feel free to put them in the chat and we will then direct it to the panelists. So we'll give you a second to think about your questions and put them in the chat. We've had one question about whether or not the slides and recordings are going to be available. And the answer to both of those is yes. We'll be sending out the slide decks to people who participated in this after the end of the webinar. And the recordings will be posted onto the Family Voices of California website in the near future. So we're going to go ahead and pause and wait for a few questions. Someone is asking if you can put up the slide with the 3 columns of activities from the family survey. So we're going to keep the chat option for asking question open for the rest of the webinar. But if you have questions that haven't been answered in this webinar, please feel free to send them to info@familyvoicesofca.org, and Ali can put that address in the chat box. Okay, we have a question that's my 16-year-old is cleared by cardiologists. He does not want to go back. He does not want to wear a mask. I want him to try and be available by text for him, and I want him to try. Teachers are very positive. Any suggestions about for children who are having fear about going back to school? And I'll leave that up to any one of the panelists who'd like to answer that question.
This is Barbara. I'm wondering if this parent has talked to her child about why he doesn't want to go back and what his fears are based on. If he doesn't want to wear a mask, he may be worried that he won't be able to breathe well in the mask all day, or he may be worried that people won't be able to see his facial expression, and so they won't know how he's feeling, or perhaps even what he's thinking about. If he's afraid, he probably has reasons for being afraid, and it would help for the parent to join the child in thinking together about those reasons and working through each one of them in a way that lets the child know that his ideas are important and understandable, and that they can work together to see if they can resolve some of the things he's afraid of.
Thank you, Dr. Kalmanson.
And also try to address that question a little bit from an advocate's point of view. I think when our children do go back, it'll be, most of our kids would have to be probably reassessed to get a sense of where they are social, emotionally, and academically. But, you know, if your child has an IEP, they would have to look at individually coming up with an individual plan of what he needs to kind of re-enter into back to school. If he needs a goal for you know, hand washing, for social distancing, for wearing a mask, all of that stuff, that needs to be put in the IEP. And also if he needs to have shorter days, if he needs to have you know, 3 days a week instead of 5, all of that stuff, those are all things that can be put in an IEP to help him transition back to in-person learning.
Thank you, Lily.
And this is Lindy. I'd also like to add something else specific to that question, but also in general, which is that so many kids of all ages are carrying so many different fears with regards to this pandemic. And I think as parents, we feel and as adults, we feel the general sense of concern around social contact. That I have talked to so many kids who are carrying extreme anxiety about germs and getting sick and what it all means. And so I think that we can't assume that our own processing capabilities and sense of safety or lack of safety in relation to this pandemic is the same as what our kids are carrying. So I just want to reiterate what Barbara was saying, and to not make assumptions about how we feel in relation to how our kids feel. I think that conversation is really important.
Thank you. Our next question, I think that all three of you might have insights to answer. But it's, I have an older child with special needs who's distance learning, a toddler with high energy, and trying to manage work all at the same time. It's hard to consistently keep calm, especially when they're both tantruming at the same time. Any tips for me as a parent?
I can talk a little bit about, again, what we've done. Even though my children are 11 and 15, it often feels like I have 2 toddlers tantruming and running in 2 different directions because they're both developmentally delayed. So I think that if your older child with special needs is a regional center client, I would reach out to them to get, and if you are able to have someone in your home, if you feel it's safe, I would ask them for an exception to the respite hours to get more respite and childcare hours. There are some families that are actually getting behavioral support, behavioral respite at home. That's a respite person that's specifically trained, like a ABA therapist, to support him with behaviors. I've also had good luck with some families getting support from the school district, where if your family is not able to get, if your child is not able to access online learning, then they will send a support person home to do it, to help them access the online learning and just, you know, while you do what you need to do.
Thank you, Lilian. Any other suggestions for parents, tips for parents about trying to keep calm during these very stressful times?
This is Barbara. I just want to mention that as parents, we are also under enormous stress and have our own feelings and our own physiological states that are affecting us as people ourselves. And so it's very important for parents to find some way to get even small amounts of time for self-care. Whatever it is, and here's this parent-centered strategies, whatever it is that helps you as a person to feel calmer in your body, more centered, a quiet place inside yourself, that you can get even a few minutes at a time. And I'm a real advocate of the 1 minute meditator. And that way you can have more resources internally yourself for those moments when both children are tantruming at the same time and need you exclusively, and your boss is waiting for you at a meeting.
Thank you. Lindy, do you have anything else you would like to add?
I would just say that the families who have been most successful with this, that I know have had to separate out their work time from their time with their kids. And so they've done it in the ways that Lilian has suggested, finding ways to have people with their kids. And I've known people who, when they are able, when they have the flexibility in their work, they have scheduled their work either during naps, after hours, but I know that not everybody has that flexibility. So if you don't, then it is through regional center, through ABA if you have access to it, and through other supports. It's a very challenging situation. If there's family supports that you have, people who can help you, and family members, drawing on those kinds of strategies.
Okay, thank you very much. It looks like that's it for our questions for right now. If other questions come up, once again, you could email them to info@familyvoicesofca.org. So thank you all. Thank you for the panelists for giving their time for this very important subject. Thank you for our interpreters and captioners, and a special thank you to the audience for giving us your precious time. We're going to be sending out an evaluation through email after this is done, and it's very helpful for us to get those back. So if you'll please go ahead and fill that out for us. This recording is going to be posted onto our the Family Voices of California website shortly. And a reminder, once again, if you have questions, to go ahead and email them. So let me double check to make sure no other questions have popped up. So I think that's it. We're able to give you, our gift for you is that this webinar took 15 minutes less than we thought it would. So maybe you can use that 15 minutes for some self-care. I have one quick question came up, is that someone is receiving respite care and they'll check in. So it's a thank you. Their fear is about bringing someone into the house as she's immunocompromised. And I think that that is definitely a fear that we all have and a balance we have to have. I'm going to circle back. I know I was about to close, but do any of the panelists have anything to say about families managing their fear about having people from outside coming into their house?
Alison, this is Lindy.
Great.
I have some families who are in similar situations, and they have managed to reach out and find to find caregivers who are in similar situations. So as an example, I have one family who has hired somebody who is a cancer survivor. So she is immunocompromised herself and is severely limiting her own contacts. And so they feel safe with her because for her own health, she needs to be extremely cautious. And I have other families who have done analogous kinds of things where they're not requiring somebody to be extra cautious for them, but they're finding people who need to be extra cautious for their own health, or because they live with elderly parents or whatnot. And so that is how they've managed to find people to come into their own homes. And that seems to be a strategy that has worked quite well.
Okay, thank you, Lindy.
So I'm sorry, just quickly, we've done something very similar to what Lindy just said. Our respite provider has asthma, so she's also at risk. When she first started, we made sure she understands that our child is immune compromised, and that if she does get exposed, or if she does have, if she goes to a party or something, that we are okay paying her for 2 weeks or writing off hours for 2 weeks while she stays away, so she wouldn't be afraid of losing her income. Whether that's legit or not, I don't know. It's what our family is doing. We've offered to just continue to pay her for 2 weeks anyway.
Okay, thank you very much. So again, I want to thank everyone who joined us today. I hope that this information has been helpful. And again, I hope that you can take a few minutes for self-care, whether you're a professional or with a parent or an individual. We all need to take care of ourselves. And we're inviting you all to join us next Friday for the part 2 of this webinar. So thank you again, everybody. And we'll sign off with that.